Welcome back to New Day Northwest. One size fits all does not apply when it comes to healthcare. Swedish has an LGBTQI+ program that focuses on the diverse community and their healthcare needs. Dr. Kevin Wang is the medical director for the program. Welcome back.
Thank you so much. I appreciate coming in today.
We are so glad you're here to talk more about this LGBTQI+ program at Swedish. What does it do? Who does it serve?
Most importantly, our program serves the patients in our communities. Certainly, our program mainly consists of LGBTQI+ members, and we want to serve our LGBTQIA+ community. We really focus on what we can do to make it a comprehensive, inclusive, and well-informed environment for our patients, which of course involves medical care. It includes patient education, it includes patient navigation to really navigate the really complex system we have here in the US and here in Seattle, of course.
Yes.
But really, we just want to focus on what we can do to make patients feel welcome.
I love that.
Are we doing enough? We're certainly working there. We're not there all the way. We know it's a work in progress, but we're doing everything we can to make it a good environment for our patients.
That's huge. I know you mentioned them a little bit, but what kind of services does the program offer, and how do patients get access to them?
Great question. So the services we offer really focusing on primary care. We think it's a great segue to get patients connected with other services. What could we do to see them beyond just their LGBTQI+ identity, right? So as a gay man, I am not just sexually transmitted infections. I'm not HIV. I'm not just mental health. What can I do to help them prevent them from getting diabetes and high blood pressure and support them as a whole person? And so we offer primary care services, and with our specialists, we can offer some gender-affirming surgical procedures, we can offer behavioral health support, but most importantly, we have an amazing patient healthcare navigator, Maddie Mooney, and they help connect our patients with outside community resources, helps them out with housing, appeals. They do a tremendous amount of work.
That's amazing. My cousin is a member of the community, and she's always told me that she went into healthcare because there was a long tradition of distrust. So what are the origins of this program at Swedish, and how was it founded and why?
Yeah. So I have to give credit to our residency program at the First Hill campus, so Swedish Family Medicine First Hill. It came out of a passion of our residents, our medical students, but most importantly, we've been hearing calls from our patients to say, you need to do better, you need to do more. We integrated an LGBTQI+ healthcare training in our residency training curriculum, and then everything just kind of snowballed from there. We started an annual healthcare conference to train clinicians who have graduated from residencies. So I never got training when I was in residency or medical school. And then we still realized our community needed more. So what happened was we sent a letter to our core leaders at Swedish. I will say within a couple weeks, I got invitations from a lot of our people in our C-suite. We had meetings, and 3 to 6 months later, we got funding from amazing donors and amazing support from our Swedish Foundation. Donors said, yes, this is an amazing program. What can we do? So our first year, we just decided to do an assessment. What can we do with the resources we have at Swedish? What can we do to build bridges? Because of that level of distrust, we had to prove to a lot of our community members and a community-based organization, this is not a one-off thing. And then just a year and a half later, Swedish said, you know what, we're all in. You are now a fully permanent funded program within Swedish. And it's grown so much in just the last year and a half.
So, which is incredible to see that is now a permanent part. This isn't just lip service, this is Swedish making a commitment, which is, it's very important to see that. How is Swedish stepping up against attacks on the LGBTQI+ community?
So I will have to, again, give credit to our healthcare navigator, Maddie. They have been a member and an organizer for years, and they really put their reputation on the line to work with us at Swedish, knowing healthcare institutions have caused harm to our LGBTQI+ members. They have their finger on the pulse of everything going on in Washington, and so when there was a Senate bill coming in to close loopholes for Medicaid to cover all gender-affirming healthcare services, they brought us in. We testified online, because it happened during the pandemic, to close those loopholes. I had the opportunity to talk with the Commission on Health, Education, Labor, and Pensions to talk about the blood donation bans on gay men and those who identify as male. We also talked about issues we had with the MPV vaccine rollout. We talk about a lot of the increase in anti-LGBT state legislation and what we can be doing as a healthcare institution to really support other healthcare institutions where those services are being banned.
Yeah.
So I'm really grateful for all the work Swedish is putting into this.
Yes. I've recently heard, well, I think a lot of people know about the Swedish Providence merger, which is great for access to healthcare, but has it affected the program in any way?
So Swedish is a secular affiliate of the Providence system, and so we are able to provide all the services we've always been able to provide. So as part of our residency program, we offer gender-affirming healthcare to our adolescents, which include pubertal blockers and hormones. We have surgeons who can offer gender-affirming surgical procedures, but what's really exciting about this merger with the Providence Swedish Puget Sound region is the work we're doing is going to inform and influence the care they provide their LGBTQI+ members. We have pilot projects happening in order to be able to help them navigate the very complex part of being a faith-based institution and working to serve all of our patients, including the LGBTQI+ community. It's really exciting.
This is very exciting. Thank you so much, Dr. Kevin Wang, for being here. It is a pleasure talking to you. We will hopefully check in with you again to see more progress at the program. And for more information on Swedish's LGBTQI+ program, you can go to the website on your screen, and you'll find a lot of resources on that page. Coming up next, my conversation with Allie and AJ ahead of their upcoming performance in Seattle, so stay with us.
This portion of New Day Northwest is sponsored by Providence Swedish.